Why do 40% of MS patients develop optic neuritis? Optic neuritis is a frequent symptom in patients with multiple sclerosis, MS, with approximately 40% of MS patients experiencing this at some point in the course of their disease. It manifests as variable vision loss, pain during eye movement, and scotoma affecting macular vision. Definition of scotoma: a scotoma is a specific area of vision loss or impairment, generally described as a blind spot, which often impacts central vision. It's a key symptom in optic neuritis and is typically evaluated through visual field testing. Common case presentation: a patient presents with sudden, unilateral vision loss over the course of hours to days. The patient also complains of eye pain that worsens with movement. On examination, visual acuity is reduced, and color vision is impaired. A scotoma or blind spot is identified during visual field testing. Optic neuritis often serves as an initial indicator of MS, but can also occur at any stage of the disease. The inflammation of the optic nerve is thought to be due to a misguided immune response, similar to the autoimmune mechanism in MS itself. Symptoms of optic neuritis: variable vision loss, pain on eye movement, scotoma affecting macular vision. Diagnostic considerations. 1. Visual evoked potential test. This test measures the electrical activity in the visual pathway when the eye responds to a visual stimulus like a flashing light or checkerboard pattern. It is useful for identifying lesions or abnormalities along the optic nerve pathway. 2. Optical coherence tomography helps evaluate the thickness of the retinal nerve fiber layer. 3. MRI to visualize the optic nerve and rule out other potential causes. 4. Fundoscopic examination to evaluate the optic disc for signs of swelling or inflammation. Statistics and prevalence. In the general population, optic neuritis occurs with a prevalence rate of approximately 5 per 100,000 people. Among MS patients, however, the occurrence spikes to 40%, highlighting its significance in MS management and prognosis. Why is it important? The onset of optic neuritis in an MS patient is often considered an important event, potentially signaling a change in the disease course and requiring adjustments in treatment strategy. Further reading: for those interested in in-depth study, consider reading the journal article, Optic Neuritis as an Early Sign of Multiple Sclerosis, which details the pathophysiology, diagnosis, and management of optic neuritis in MS patients.